Well, good evening, everyone. We still have some folks coming online here, but we'll go ahead and proceed. And they can just catch up with us as they come in. I just want to take this opportunity right now to welcome everyone to the Dayton VA Medical Center's Eligibility and Enrollment webinar. We are thrilled to be here with you tonight. I want to say by starting right now that this event is actually being recorded. So if there's something you miss or later want to rewatch, not to worry, you'll be able to do that. We will be sending you a link to the recording after this event. You can also share that link with anyone you feel may benefit from the information we're sharing here tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center. I am an Air Force veteran, and like many of you, I once had many questions about VA healthcare. Let's see if we can answer your questions this evening about eligibility, enrollment, and healthcare through the VA. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have a number of callers on with us tonight, and we want everyone to participate. Which is why we're keeping everyone muted. This is simply to ensure that there isn't excessive distracting noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane on the bottom right of your screen. Simply type in your question and the presenter will get to you as soon as they can. For the sake of time, if we don't get to your question during the presentation, you can reach us by phone or email, and we'll be providing that contact information at the end of the presentation. While we have a long history of care here at the Dayton VA, this is actually the 76th anniversary of the modern Veterans Administration. You know, we're really proud to be not only one of the oldest campuses in the VA, but also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's also top rated by the veterans who it serves with more than a 98% satisfaction rating. This is a benefit that not everyone is able to receive. This is only available to veterans. And I think probably everybody here that's on with us tonight would like to know more about how they can get that care. Well, that's exactly why we're here tonight, and we'll learn a little bit more about VA healthcare.
VA is America's largest integrated healthcare system. We are committed to providing veterans with timely, high-quality healthcare. VA offers a variety of healthcare services for eligible veterans, from primary to urgent care to telehealth and nursing home care. When you choose VA, we promise to make care available to you when and where you need it. You may be eligible for VA healthcare if you served in the active military, naval, or air service and did not receive a dishonorable discharge. You can apply for VA healthcare by visiting VA's eligibility webpage or by applying at your local VA medical facility. Veterans can also apply by phone by calling 877-222-8387. You can find your nearest VA medical facility by using the VA's Facility Locator webpage. If you are enrolled in VA healthcare, you may be eligible to receive care from a non-VA provider in your local community. This is known as community care. You may be eligible for community care in one or more of the following situations. You need a service not available at a VA medical facility. You live in a U.S. state or territory without a full-service VA medical facility. You qualify under the grandfather provision related to distance eligibility for the Veterans Choice Program. VA cannot provide you with care within certain designated access standards. It is in your best medical interest, or a VA service line does not meet certain quality standards. To receive community care paid for by VA, you must generally be eligible and officially authorized by VA in advance. To find out if you are eligible, talk to your healthcare team. You can learn more about community care by visiting VA's Community Care webpage. If you need treatment for a minor injury or illness that is not life-threatening, such as a sprain, cough, sore throat, or earache, you can access VA urgent care and same-day services at your local VA medical facility. You may also be eligible to visit an in-network urgent care provider in your local community. To be eligible for community urgent care, you must be enrolled in VA healthcare and have received care through VA from either a VA or VA community provider within the past 24 months. To find out if you're eligible for community urgent care, contact your local VA medical facility. If you're eligible, you do not need to get prior authorization from VA to receive community urgent care. If you get community urgent care, make sure the provider is in-network. To find an in-network provider, use VA's provider locator or contact your local VA medical facility. To learn more about community urgent care benefits, visit VA's community care website. If you live too far away to easily visit your VA healthcare provider, you may still be able to get the care you need remotely with VA telehealth. With VA telehealth, you can meet with your healthcare team and more from the comfort of your home or mobile device safely and securely. To learn about telehealth options in your area, contact your medical provider or your local VA medical facility. If you are eligible for VA healthcare benefits, you may be charged a copayment for care or medication provided or paid for by the VA. You may be charged a copayment when your care is not related to a service-connected illness or injury, your income is greater than a certain amount, or your income information is not available. However, you may not have to pay a copayment in some situations, such as treatment you receive for a service-connected condition, or if you are catastrophically disabled. For more information about copayments, visit VA's Healthcare Information webpage, call 877-222-8387, or contact your local VA medical facility. When you use VA healthcare for a condition that is not service-connected, VA may bill your health insurance for medical services, supplies, and prescriptions. In that case, we will ask you for your health insurance information so we can bill your insurance correctly. Money that VA receives from your health insurance goes directly back to the VA medical facility to pay for treatment, medications, supplies, and equipment for veterans. To learn more about veteran health insurance, visit VA's Healthcare Information webpage, call 866-400-1238, or contact the Facility Revenue Office at your local VA medical facility. If you have a concern about the care you're receiving at VA, we're ready to help. The best way is to contact the patient advocate at your local VA medical facility who can help you with almost any problem. If you're a veteran in crisis or know one, please call 1-800-273-8255 and press 1, or text 838-255, or use support for deaf or hard of hearing by calling 1-800-799-4889. Help is available 24 hours a day, 7 days a week, every day of the year. You can also visit the Veterans Crisis Line website to chat online and find more resources. At VA, it's an honor and a privilege to serve you. Thank you for your service, and thank you for choosing VA. For more information about VA healthcare, visit VA's website or contact your local VA medical facility.
Before we take any questions you might have already, here with us tonight is someone who can actually tell us more about how you can enroll to receive quality care through the VA. Chris Cox is from our Eligibility Enrollment Office and is going to try to give us a brief presentation that goes into more detail about eligibility and enrollment with the VA. Chris?
Hi, everyone. Thank you for joining us tonight, and thank you for your service for our country. I myself am an Air Force veteran. I served 6 years at Wright-Patterson, and I've been here at the VA for about 6 years now. So right now we'll go over the eligibility and enrollment section. A lot of it was hit on that video, but we'll go ahead and go in a little bit more detail as well. Next slide, please. Okay, so for the agenda for tonight, so we're going to go over some common terms used that we may use in the eligibility world. Who is considered a veteran, character of a discharge, the criteria VA uses to determine your eligibility, and then your other eligibility factors. Okay, so everything that we go over tonight is going to be based off of our VHA directive 1601A- or .02. It's pretty much telling you the eligibility determinations. So our VA directive, that is the law, that is what we have to go off of. We can't change it here at the VA, and there's no way we can change it. This is our law, that's our directive, and that's everything we go off of. Okay, so some common enrollment terms. Registration, it's pretty much adding a veteran or a patient into our electronic system. Enrollment is the acceptance of that eligible veteran into the VA healthcare system, and we assign you a priority group. Priority groups can go from 1 to 8, and it all determines on the time served, your income, and everything like that. An ineligible is a veteran determined to be ineligible for enrollment. Rejected, and we'll go into more detail on ineligible and rejected as well. Rejected, income exceeds VA's national or geographical adjusted. It's based off of your zip code, is why you might be rejected. So if you're not service connected and you make too much money, then you might be rejected. Service connected, veteran who has an illness or injury that you incurred on military service or active duty. And that's based off of the VBA and your VA regional office. Okay. Next slide. Compensable, monetary benefits related to a service-related illness, disease, or injury. And then non-compensable, not in receipt of monetary benefits from VA for a disease, injury, or illness. Non-service connected, a veteran who has been discharged from the active duty military and does not have any illness or injury that they incurred during the military service. Your non-service connection pension, veterans pension, and a tax-free monetary benefit payable to low-income wartime veterans. So who is considered eligible for healthcare? I'm sure everyone has this question. That's why we're here tonight. So a veteran meets basic eligibility requirements for VA healthcare if they meet the following criteria. So one of them is the minimum duty requirement. So 1 day of active duty service for the following enlisted on or before September 7th, 1980. So if you had 1 day of active duty service and you were enlisted on or before September 7th, 1980, you would meet the eligibility requirements. Or if you're an officer on or before October 16th, 1981. That is just 1 day before those dates. If you weren't in before those dates, you have to have 24 months of duty service for the following: September 7th, 1980, or an officer after October 16th, 1981. The Reservist and National Guard Act, you have to be activated to active duty orders using the Title 10 executive order. So if you're National Guard or a reservist for those 24 months of active duty service. Character discharge requirement is to be honorable or under honorable conditions character of discharge. And we'll go into more later on in the slides. Okay, so exceptions to minimum duty requirements. So if you had an early out, enlisted only, that information will be on your DD 214. If you had a hardship, discharge due to a disability that was incurred or aggravated during your line of duty, again, you'll have to put in for your service connection with that. Veterans with compensable service connection disability, same thing. Contracted for a 15-month enlistment, so national call to service, it'll be on your DD 214. and you have to have completion of required active duty service. And then active duty for training 0% service connected National Guard or reservist. Okay, next slide. Okay, so characters of discharge. This is for enrollment. Your character of discharge must be honorable, honorable for VA purposes adjudicated, or under honorable conditions for general discharge. Okay, if the character of discharge is one of the following, so other than honorable discharge, uncharacterized discharge, or bad conduct discharge. This must be reviewed by our VBA, so the Veterans Benefits Administrator. Veterans may apply for VA healthcare, but their record remains in a pending or registration only. The VBA will make the determination for one of the following. So it will either be the service member is entitled for healthcare benefits, or they're not entitled for it, and that'll come from the Veterans Benefits Administration. Next slide. So ineligible veterans. Character of discharge would be dishonorable or dishonorable for VA purposes adjudicated. Ineligible duty requirements. So they do not have the 24 months of active duty without the exceptions after September 7th, 1980. Does not have 1 day of active duty service if enlisted before September 7th, 1980, and was a reservist or National Guard member never activated under Title 10 executive order. So that's the big key, is that they were never activated and they didn't have the 24 months. Also, tentative eligibility in emergency cases. We'll go over that over the next slide. And then based on military discharge. So when someone has a tentative eligibility, so in emergency situations, a veteran must sign a VA Form 119. It's a report of contact. It's stating that you're agreeing to pay for services if you are found ineligible. So if you were to go see our emergency department, you would have to sign a humanitarian form, which is that VA Form 119, stating that if we find that you are ineligible for care, you will be responsible for paying any emergency costs that comes from our department. Next slide. So there's multiple ways to enroll through that video. As you saw, there the 3 ways to enroll. In person here at our Dayton VA Medical Center. If you come into our main campus here in Dayton, you go into the main doors into the lobby. There's a left. If you take a left down that hallway, keep going straight, you'll see the release of information. You'll see the green desk, and then you'll see us, the eligibility office. You swing in there, bring your DD-214, and we'll have you fill out a 1010 EZ form if you've never been seen here before, or if you've never enrolled. Another is online, so www.va.gov. You'll be able to enroll in there. And then you can call the National Health and Eligibility Center at 1-877-222, and that's 8387. It looks like I left those 2 numbers out. It's 8387. I'll go ahead and put it in the chat here in a minute as well.
And we'll be giving that information later on as well.
Okay. And then that's it. Do we have any questions?
So yes, thank you very much, Chris, for that presentation. We're going to take some time to answer some questions. Again, I just want to remind everybody that excuse me, I'm sorry, that this is being recorded and everyone has been muted, but you can ask questions by putting the information into the chat pane, and we'll be glad to answer any questions you have. If time runs out this evening, we don't get to your questions, not to worry. We'll have your contact information and we will reach out to you later on. So please feel free to ask those questions by typing the questions into the chat pane. So we do have some questions right now. Sherry wants to know, can a non-enrolled veteran just pay out of pocket for a screening? And can you answer that, Chris? Chris, I believe you're muted right now. Yeah.
I'm so sorry, Scott. I was on mute. Can you repeat that question? I'm so sorry.
Sure. Sherry wants to know, can a non-enrolled veteran just pay out of pocket for a screening?
So as far as the screening purposes, they can't pay just out of pocket. But I can definitely take your information down, Sherry, and then I can get back with you on that question.
Okay. Jerome wants to know, are Vietnam veterans automatically eligible?
So they are not automatically eligible. They would need to bring in their DD-214 and also fill out the 1010EZ form. And then once we have all that information, we can load them into the system, and then we can put them in the correct priority group that would be deemed necessary.
Okay, great. Fantastic. Next question. Mike wants to know, is there a VA enrollment period like you'd find with a company's health insurance?
There is not. So you can actually come into our facility or by one of those three ways. You can do it on that website or come in person uh, or call that number and then just bring in your information, fill out the 1010EZ form with your DD-214, and we can get you into the system.
Okay. Roy wants to know, what disqualifies someone from receiving VA benefits? And I'm going to presume that he is talking about VA healthcare benefits.
So it would come down to if you are not service connected and you are above the income threshold, that can mark you as ineligible. And then also if you are discharged under other than honorable conditions or dishonorable conditions.
Okay. Mary wants to know, I've been told I make too much money to qualify. Should I still apply for benefits?
Absolutely, I would suggest to still apply. You might have a service connection, or might be able to qualify for a service connection as well. I would always say to bring it in, and we can check that for you.
Right. And if I could piggyback on that, this is something we'll talk about a little bit later, but the PACT Act, which is the Promise to Address Comprehensive Toxins Act, which was signed into law this last fall, actually is opening up healthcare for a lot of veterans. Korea, post 9/11, Vietnam, veterans who've been exposed to toxins and have presumptive conditions. They may not have qualified for healthcare before because they did make too much money, or another reason, maybe they didn't have all service connection and so forth. So that's changing rapidly for us. If you retire and suddenly your income has changed, and now with the PACT Act, that veteran can get service connection through presumptive conditions that are listed through the PACT Act. We highly encourage everyone to explore the possibility for requalifying or qualifying again for healthcare. Joy wants to know, once enrolled, am I always enrolled in VA healthcare? That's a really great question, Joy.
That is a great question, Joy. Once you enroll, you will always be enrolled with the VA. There's times that we may need to check your income and go from there to see if you qualify for a higher priority group. But once you are enrolled with us, you are enrolled with us, and you're good to go.
And again, I would add a little bit more to that and say that once you're enrolled and you actually have your first appointment and you're actually getting care from us in the VA, a lot of veterans don't realize that they need to get their annual physicals and stay enrolled with the VA. Yes, you're still enrolled, but you're not necessarily on active enrollment with us. And we encourage everyone to do that, because that is how we get our funding, is to ensure that somebody is an active enrollee. And even if you feel like you don't need care, it's beneficial for you to go in and get your annual physical. Everyone should, for their own personal care, but also it helps fund the VA for all your fellow veterans as well. So that's another reason we encourage everyone to go back in and make sure that you maintain your active enrollment status. Next up, we have a question about what is an VHIC card and what makes me eligible to receive one?
So the VA, we call it a VIC card. So have you would have to be eligible for care here at the facility. So our VIC card, if you are deemed eligible to be seen here at our facility, you can get it's a little veterans card that you can use for being seen here and also getting discounts or anything like that. A lot of people get them just to use for those discounts that they get that they don't have uh, a DoD ID from the military anymore. So people will use the VIC card for their discounts.
Right. Which is totally different than a card that you might get from your county VSO as well. So that's another reason you want to come in and get the card through us. Daniel wants to know if you are service connected already, can I assume I am enrolled? Terrific question.
Daniel, so no, you would still have to come in and do the enrollment process. So a lot of people just assume that they can just be seen no matter what. I would state to bring in your DD-214 and come to our eligibility department and get enrolled, and then you can get your primary care doctor as well.
Yeah, a lot of people don't realize, Chris, that the VA, the Veteran Affairs, is actually comprised of three different arms, which is the National Cemetery Administration, but also the Veterans Benefit Administration, along with the Veterans Health Administration. That's a lot of people get service connected, start receiving benefits through VBA, and never enroll in VHA. And that's why that's a really great question. A lot of people automatically assume that if you've gotten service connected and you've enrolled with the VBA, that you're already enrolled in veteran healthcare, and that's not the case. You still need to come talk to Chris, get an appointment with him or his folks, and come in and fill out that 1010 and bring your 214 in and start that process for getting enrolled with healthcare. John wants to ask, can a spouse of a veteran enroll in VA healthcare?
Hi, John. Great question. Unfortunately, no. Only veterans can be eligible to be seen at the VA, but spouses can be accepted with CHAMP VA. And their number, I can put it in the chat. It's 1-800-698-2411, and that's with CHAMP VA.
Okay. Now, this is another very common question that we hear. Daniel is asking if I have TRICARE for Life and Medicare, how does that work with the VA healthcare?
So TRICARE and so a lot of people that have the VA healthcare that are seen here at our facility also have other insurances as well. So if you're being seen here at our VA and let's say you have a copayment, they will bill your other insurance. So they would probably but the thing is with TRICARE that it's government and government, so government doesn't bill government. So if you do have a copay, you'll still have to take care of that copay as well.
Yes. I'm actually a retiree. I have TRICARE for Life, and I choose to use the VA over TRICARE. I still have that option, but I actually I have terrific care through the VA. And oh, by the way, I have care through the PAC team out at Wright Pat, but also I have lower copays when using the VA. Or if you get that service connection, for some people, you don't have to worry about the copay depending on your disability rating. So that might be another reason for you to explore looking into getting VA healthcare along with that TRICARE and Medicare. Never pass up an opportunity to take advantage of a benefit. Next up, we have Gary. Gary is asking, what is the income cutoff from receiving VA healthcare?
So Gary, that's a great question. But it's one of those questions that there's not a specific number. It's based off of your where you're located at. If you want, Gary, I can give you my phone number. And if you want to call me tomorrow, I get in at 8, and we can talk about what the threshold is for you if you would like. It's 937-268-6511, and my direct extension is 4318.
Okay, Sam is asking, if I move, do I have to re-enroll if I transfer to another VA in a different state?
So that's a great question too. So when you do transfer to another state, you will have to go to that VA that you're wanting to be seen at, and then they'll probably have you do the 1010 Easy. It's called an Easy R. It's just an update, and they'll have to bring you into their system.
Okay, next question is, does having insurance affect my VA benefits, specifically Medicare?
So having other insurance will not affect what priority group that you get placed into. Like I stated earlier, having another insurance is suitable for when you have copays, and then they can bill those other insurances, as long as it's not a government insurance.
Right. Next question is, why does my income need to be reported for VA purposes?
So the income being given to us, it's so that we can put you in the best priority group. So some priority groups you don't have to have copays, and if you are meeting that threshold where you're not above, we're able to get you taken care of in a different group to where you won't have those copays, which is why we ask for the veteran's income and their household income.
Okay. Actually, we've had a couple people ask about the income threshold eligibility, and again, Chris has given his contact information. We encourage everyone to call eligibility and set up an appointment, and they can go through that. It's not a here is the number. It really is dependent on several different factors. So I would encourage everyone to contact eligibility, and they can walk you through that process. Wayne is asking, in the application process, I don't see an area to mark my service in Somalia. Seems like my combat time doesn't count for benefits. There's no place to check the box.
So what is the question there, Scott?
So I believe what the question is, if you have service overseas, and looking for that, qualifying for combat time, and making sure that your boots on the ground in the theater, basically, to qualify you for VA healthcare. It doesn't show that on the application, but what we ask is that you bring your 214 in, which is what eligibility uses to qualify you and voila, your application. Correct, Chris? Am I saying that right?
That is correct. That is correct.
Okay.
We'll be able to see the
I
month that you
I
served.
don't want to do your job tonight, so if there's some
You're
more
doing great, Scott. Thank you.
Okay.
I'm also putting the eligibility enrollments extension into the chat for anyone that's having the questions about what the threshold is. Give this number a call. They're open 7:30 to 4:30. Give that number a call, and then they'll be able to answer any questions that you may have as well.
Okay. Jerome's got a great question here. Can annual physical exam records be sent to civilian physicians' offices?
So that is a question that is not best suited for me to answer. I can look that up though. I
think I can answer that actually.
Yeah.
And basically what that really has to do with community care. Absolutely. There's a great relationship that the VA has with community providers, especially in network and so forth. But your medical records are your medical records, and I believe all you have to do is go to your physician. If you've had some exams here with at the VA and you want to share it with another physician, that all you have to do is put in that request through your physician to request the records from the VA. So that should not be a problem. That's reciprocal, by the way. So if you have a civilian provider that has records that you want to have sent over to the VA, it's the same. If you have you get your primary care physician who refers you to a specialist, and you say, "I've already been seen for this, and I need some information," then yes, absolutely, those records should be shared back and forth, and you just have to give permission for those records to be shared. Frank is asking, I am retired on Social Security. Is there an income threshold for eligibility on that income?
So that's the same thing. Contact our eligibility office with any threshold questions. They'll be able to pull your record up and take a look at your zip code and go over anything with the income threshold.
Okay. Ray wants to know, after you are accepted in VA healthcare, do you have to be seen by a VA doctor if you've already have a primary care doctor? And
So
you want me to answer that too, Chris?
you don't have to be seen here at the VA. It is an option that that is available if you are eligible. Scott, with you being a veteran, you might be able to speak on that a little bit better as well.
Absolutely. It is up to you where you receive your health care and what doctor you want to see. You're going to be signed a primary care provider. You can you're going to have to see your primary care physician at least once a year for your annual exam to make sure that you maintain your active enrollment. But at the same time, if you have another doctor out in the civilian sector that you are really comfortable with, you can request to see that physician or receive care through that physician through the VA, and that would simply be a referral, I believe. And even we do have Greg Tucker on with us too, and Greg, maybe you can clarify. Did I get that right?
Yes, you did.
Okay, terrific. Daniel wants to know what document is used to verify income. IRS tax submissions? Is that what we're using?
So it'll come based. So we do not need any documentation when you're doing your income. What it is that we send this documentation off to. It's it's called HEC. It's HEC. They're the ones that'll be able to look into that and base everything off your income. We do not need the IRS tax submissions or anything like that. That's something that they look into when you write in how much your household makes.
Exactly. So those are public records. We're not asking you to bring in your IRS tax statements or your bank accounts or your stock portfolio or anything of that nature. And that's that's a really great question, because a lot of people are concerned about that. They keep their financial information close hold, and understandably so. But there is public record out there that we can go to help determine that. Again, I've got another question about, can my spouse be seen at the VA? And I think you had answered that already, Chris, right?
I did. So the spouses cannot be seen at the VA, but I did put in the chat the Champ VA number that the spouse can apply for, and that's the 1-800-698-2411.
And where are they seen when they go through Champ VA?
That is one of those questions that I would ask them when you're on the line with them. But that is what that number is in the chat.
Jim is asking, are service members covered under the PACT Act?
So
Like,
all service members, or are we talking about specific?
I'm not certain.
Okay.
And we talk at all. Okay, yeah, he's just asking basically are service members covered under the PACT Act? I can talk a little bit about that. Uh, again, the PACT Act is the promise to address comprehensive toxins.
Mhm.
This is legislation that was signed into law in August by the president and is expanding health care, actually VA benefits, not just health care benefits, but uh, benefits for as compensation, survivor benefits, along with healthcare benefits for veterans who have served in the military in certain windows, time windows, and theaters of operation, and have presumptive conditions that would qualify them for care through the PACT Act. That list is long and comprehensive, and what I would recommend is that anybody who wants more information about the PACT Act, that they go to www.va.gov/PACT, and you can find the information there. I'll go ahead and put that in the chat. That's again www.va.gov/PACT, and you'll find a wealth of information there about not just what qualifies you, but also that is the location where you go to file a claim. Additionally, we do these webinars every month, and every other month we do a PACT Act webinar. So if you have any interest in learning more about that through one of our webinars, you can also register for the webinar next month. Just go ahead and reach out to us in one of the numbers we're going to give you here shortly, and we can send you information about the PACT Act and send you information about how to register for the next upcoming webinar that has these subject matter experts that can answer all your questions about the PACT Act. I believe that's all the questions we have. I'm going to go ahead and run through these real quick here one more time and make sure I didn't miss anybody. If I did, I apologize. I think we've got all the questions, but now if you have a question and we haven't answered it, feel free to type that in the chat pane. Again, you can reach out to us later on. Greg, if you want to give us the next slide, please. So yes, if you have questions, need any answers, feel free to reach out to Eligibility and Enrollment. Their number is 937-267-7608. Or if you have questions about PACT Act and want some answers right away, you can call our program coordinator at 937-268-6511. Extension 5807. Again, that extension is 5807. Or go to www.va.gov/PACT. Again, there you will find all the information that you need to know about theaters of operation, presumptive conditions, and be able to file a claim there. Something I want to clarify here right now is that when you do file for a claim through VBA for the PACT Act, that does not automatically enroll you in VHA healthcare. So we want to make sure that that you simultaneously enroll for healthcare, especially if you feel that you are eligible through the PACT Act. You will definitely be eligible for healthcare. So we got several ways to enroll with the Veterans Health Veterans Health Administration healthcare. Number one is in person at the Dayton VA Medical Center. And you can just simply go to the eligibility and enrollment desk. And as Chris says, when you come through the main door, you turn left and walk down the hall, and you'll see just right down the corridor, you'll find the eligibility and enrollment desk there. Stop in. They are happy to help you. Make sure that you do bring your DD 214. Also, you can download a VA 1010 in advance and fill that out in advance. If not, they'll be glad to help you with doing that. You can also go to www.choose.va.gov/health and apply there as well. or you can call the National Health and Eligibility Center at 877-222-8387. And again, you can mail in your VA Form 1010 EZ to the Dayton VA Medical Center to the address listed there, 4100 West 3rd Street, Dayton, Ohio, zip code 45428. And if you are in the outlying areas and you don't want to come all the way into Dayton, we have what we call community-based outpatient clinics in Lima, Middletown, Richmond, and Springfield. They can also help with processing your application for VHA healthcare. Their numbers are listed there. Feel free to give them a shout and set up an appointment, and they'll be glad to assist you with that. So again, we encourage you to come into the VA, whether it's at the main campus here in Dayton or one of the CBOCs, or again, just go to choose.va.gov/health, and you can find a lot of information there as well. So we've given you some phone numbers. We've recorded this webinar. We'll be sharing the video with you. So if you didn't quite catch something, you want to see it again, or you want to share this information with somebody else who you think will benefit from it, we are highly encouraged you to do so. We'll get that video to you in the next day or so. I think we actually have a couple more questions here. Yes, the WebEx meeting is being recorded, and you can watch it again. Again, we'll be sending that link to you here in the next day or so. And what documents do you need to file? Jim is asking that question. Jim, again, all we need you to do is bring your DD-214 in and a VA 1010, or you can actually get the VA 1010 here at the campus or one of the CBOCs, and we'll help you fill that out. Something that we probably need to let everybody know, not everybody, oddly enough, knows where their DD-214 is. If you have lost your DD-214, contact your county Veteran Services office. They can actually help you obtain a new 214 before you apply for health care. So I believe that's all the questions we have tonight. So we hope we've answered your questions and helped you learn a little bit more about healthcare and the VA and in general, and are ready to enroll today. So I want to thank our panelist, Chris Cox, for the great information he shared with us this evening. And thanks to everyone who attended this evening. And have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.